There are several problems facing Canada's healthcare system today. A major one is an aging baby boomer generation. As more baby boomers retire and grow older, they require more medical services. There is not enough space in long-term care homes for the ill and elderly, and as their numbers increase, this issue grows in importance. Long-term care homes are currently at 98.9% capacity in Ontario. Patients who require these care homes are kept in acute care beds in hospitals after the acute care phase of their illness. While they cannot go home, they also cannot go to a long-term care home, all while their health conditions deteriorate. This is where this project comes in. The purpose of this project is to develop and execute programs that involve physical and physiological exercises that can aid in maintaining and improving optimal functionality and mental wellness in patients awaiting alternative level of care placement. The patient's health is the primary focus. While patients wait for long-term care homes, their conditions should remain stable or even improve to the point where they no longer need to be hospitalized. Through the use of activity programs designed for these patients, we hope to prevent deterioration, improve patient health, and even ease the load on hospitals and long-term care homes. This project will be entirely executed in hospital and will include a description and classification of alternating services for patients to strengthen functionality and mental wellness. This project will employ the use of several healthcare professionals such as project coordinators, nurses, physicians, and recreation therapists. This project will take several months to fully implement, but the benefits will be long-lasting and worthwhile. The benefits of this project are wide-reaching and encompass more than improving patient health, although that is the main objective. By creating activity programs to maintain and improve patient health, we can effectively limit the number of patients in acute care beds and help to alleviate stress and tension in nurses and patients. We can also increase cost productivity by preventing risks of chronic conditions and help to discharge patients if their condition improves. As outlined previously, there are several objectives for this project. The primary goal is to prevent physical and mental deterioration of patients. A secondary objective that ties into that goal is the maintenance and improvement of functionality and mental wellness. As mentioned earlier, the patient's health comes first, and all objectives are geared towards improving the health of patients. Health outcomes for patients are split into several levels from 1 to 4. Level 1 is the most basic health goal. In this level, patients should be capable of independent gross motor movements. For example, sitting up and standing alone for some period of time. Levels 2 to 4 increase in difficulty, with the ultimate goal being pre-illness autonomy and the ability of a patient to go out in public on their own. The physical benefits for patients within each of these levels include improving psychological health and alleviating symptoms of depression, stress, anxiety, and sleep disorders, as well as improving physical health and reducing the risk of chronic conditions such as obesity, heart disease and stroke, high blood pressure, and type 2 diabetes. Through therapy, nutrition counseling, cognitive and physical exercises, patients can regain autonomy and health in their lives. This project also aims to provide a support system for patients by involving their families into the care and creating a space for patients to interact and exercise together. To ensure the success of this project, many team members are needed to work in cooperation, all with their own specific duties and responsibilities. These team members are nurses, physicians, program developers, social workers, the Northford Health Facility, registered dietitians, physiotherapists, and recreational therapists. All of these positions work together to ensure the highest quality of care throughout the project. Team members involved in the specific program activities focus on maintaining and improving motor function, cognition, and communication skills. Speech pathologists, physiotherapists, occupational and recreational therapists all focus on increasing patients' physical and mental ability. This process is facilitated by nurses, physicians, and program developers to maintain communications between patients and healthcare providers, as well as monitor patients' progress throughout the program. The Northward Health Facility is where everything will take place, and the physicians and nurses will be current employees of the facility. The implementation of this project will require the full dedication of patients and providers. Therefore, their opinion on this project will be taken into consideration. The activity programs will be created through an iterative process between patients and healthcare providers to ensure that the programs evolve with the patients and that the correct level of care is always being provided. Program coordinators will create program plans, and these plans will be administered individually or in a group setting. Mental activity programs will include mind games, therapeutic music, pet therapy, multi-sensory environments, as well as photography and creative arts. Physical programs will include fitness, games, nutrition counseling, crafts and woodworking, and simple sports. The timeline for this project's implementation is roughly 2 months, after which the program will be implemented within a few facilities. Once the project is underway, we aim to reach certain targets throughout the process. In our patients, we hope to limit deterioration from 5% to 0% a day and reduce death rates in patients waiting for alternative level of care to 0%. To do this, we will implement 7 or more new in-hospital activation and exercise programs that are both individualized or group programs and allow all patients to have equal access to the various services. We aim to have programs implemented in all hospitals in the area within the next year and improve patient health outcomes in a range of areas up to 5% per day. These areas include enhancing tolerance, concentration, and attention span, and increasing responses to visual, tactile, auditory, and olfactory stimuli. This project, however, is not without its risks. The project charter outlines all required facilities and professionals and the execution of the project. One risk is that there is no guarantee of achieving all of those requirements. We may be faced with a lack of community resources, locations, and qualified professionals. To mitigate those risks, we hope to receive support from hospitals and care homes in the community and encourage applications by reaching out to education facilities and providing program-specific training. Another issue is the costs involved in undertaking this project, such as the costs of locations and extending program staff. After determining the extent of these costs, we will work to come up with a compromise with viable locations and receive funding from government and other facilities to manage the pricing. We will design the program to be cost efficient while still maintaining effectiveness. Other risks include a lack of preparation, no long-term certainty, and that professionals may not adopt new implementations. By emphasizing the importance of this project and maintaining a similar standard of training throughout the project, we hope to bring everyone onto the same page and be fully prepared for this project's implementation. We will compare this project with similar projects and learn from past mistakes to improve this operation's efficiency and efficacy. The success of this project depends on the team members, the facilities, and the patients. Together, we can create the best possible solutions for patients and improve health outcomes not only in this facility, but in any other facilities that require this service.